Thank you, Catherine. It was good to see you again, and I want to thank you for that very insightful talk that you've given, something that we all need to pay attention to. Now I'd like to present a promotional talk by Mr. Eric Gruntfest, who will be talking on coding, billing, and reimbursement for Sanuwave Energy First products. So let's welcome Mr. Eric Gruntfest.
Thank you, Bob, for that intro. Welcome everyone to the Coding, Billing, and Reimbursement lecture for the Sanuwave Energy First product. Today, we're going to be talking about the UltraMIST and the dermaPACE machines and the coding, billing, and reimbursement for both treatments. The reimbursement will focus on the hospital outpatient and the private office setting, and we'll also go over some billing case examples for UltraMIST. We'll start today with the reimbursement, coding, and billing for UltraMIST. So if you are familiar with UltraMIST, it is a machine used for ultrasonic treatment of wounds. The CPT code for UltraMIST is 97610. That is the procedure code used to bill for the treatment of UltraMIST. The definition for 97610 is low frequency, non-contact, non-thermal ultrasound, which includes topical applications when performed with wound assessment and instructions for ongoing care per day. That being said, 97610 is billed as 1 unit per day for the treatment episode. That becomes important because of the CMS designated definition, or rather the status indicator for the CPT code, which is Q1 status indicator. Q1 means sometimes therapy code, and items in this therapy category are paid separately when they are not furnished with any other therapy plan of care. When they are furnished under a therapy plan of care, they are considered to be a physical or occupational therapy service and paid under the MPFS, which is the Medicare Physician Fee Schedule. So in short, the Q1 status indicator for this code means that it should be billed separately by itself with no modifiers or any other codes. When it is billed on the same date of service with any other code, that is a separately payable code with a status indicator of ST or V, the 97610 procedure is packaged and not paid separately. So the medical necessity for UltraMIST is as follows. UltraMIST is considered reasonable and necessary wound therapy, and it's eligible for coverage when any of the following conditions are met. So UltraMIST is used on wounds, burns, and ulcers that meet Medicare coverage criteria for debridement. And that criteria could be a failed conventional debridement for ulcers that are too painful for sharp or excisional debridement, or really any contraindication to sharp or excisional debridement, and also ulcers that have had no documented evidence of improvement for 30 days or greater. Now, this is not specific to just venous leg ulcers and diabetic ulcers. This could be any chronic ulcer. That's important to understand for the documentation criteria. Now we'll talk about the Medicare reimbursement specifically for UltraMIST. UltraMIST is reimbursed in the hospital outpatient setting, as well as in the physician office setting. In the hospital outpatient setting, 97610 procedure code is listed under the APC grouping 5051, which is defined as level 1 skin repair. And the reimbursement in the facility is $179.55. That is a national average, and that is subject to the change according to the hospital wage index adjustments. The professional fee in this procedure is $18.49 to the physician when done in the hospital setting. UltraMIST is also reimbursed in the physician office, and the national average for per application is $417.35. Again, that is a national average, and that is adjusted based on provider geography. And that is per application. In this example, This is a recent example where a 66-year-old patient with a 12 square centimeter wound received UltraMIST weekly on Mondays, Wednesdays, and Fridays for, I think, the first 3 weeks in March. And this is a private office setting. This patient had Medicare Part B as their primary and a good supplemental secondary. So the patient had no copays or coinsurance. There was no out-of-pockets for the patient. As we said before, the national average in the private office is $417.35. However, in this example, the adjusted allowable for Medicare put the provider at $496, just a little over that, per application. The provider, each time they misted the patient, they billed 97610 with 1 unit. And again, that's per day per treatment. There was no other procedures done at this time. There were no modifiers needed or used. As expected, Medicare paid 80% of the $496 allowable, which was just over $397. The remaining balance, which was close to $100, went to the secondary, and the total payment for each claim came out to $496.94, which was their local maximum allowable rate. As of this recording, 6 claims were paid at the full rate for a total of $2,981, with 3 more pending. Once they are paid, the total expected reimbursement for 9 dates of service or 9 treatments is $4,472. And again, that is based on this specific provider's local MAC reimbursement rates. In this next example, we have a patient that was treated in the hospital outpatient setting. This was an 89-year-old patient with a leg ulcer that received UltraMIST treatment for a month. In this case, it was done twice a week. The patient insurance had 100% coverage, meaning the patient had no copay or coinsurance or any out-of-pocket costs. In this example, because it's a hospital outpatient procedure, the national average is $179.55 as a payment to the hospital setting. And that, of course, is a wage index. That, of course, was adjusted by the hospital wage index, which we couldn't verify at this time. The billing that was done was similar to the previous example. 97610 CPT code was billed as 1 unit. There were no modifiers in this situation, meaning they did not bill any other codes, and there was no modifiers needed in this case. The facility was paid traditionally by Medicare at 80%, and the secondary picked up any of the remaining balances. In the hospital setting, the Medicaid payment did cover the 20% additional reimbursement. The total of 8 claims that were paid at $179 for that month came out to a total of $1,436, and the professional fee total was $147. Many times we get questions on whether or not an E&M code can be billed or any other CPT codes can be billed with 97610. As mentioned before, when they are billed together on the same date of service, 97610 is not separately payable. However, if the procedure is completely separate and distinct from the ulcer being treated with MIST, such as an E&M code, and appropriate modifiers are used, they would be paid separately. Again, that is only if they are separate and distinct procedures. Next, we'll go into the reimbursement, billing, and coding for the dermaPACE machine. So dermaPACE is FDA cleared for chronic full-thickness diabetic foot ulcers with wound areas measuring no larger than 16 square centimeters, which extend through the epidermis, dermis, tendon, and capsule, but without any bone exposure. dermaPACE is indicated for adults 22 years of age or older that have a diabetic foot ulcer that's chronic, greater than 30 days in duration, and it is indicated for use in conjunction with standard diabetic ulcer care. So dermaPACE was granted a Category 3 procedure code, temporary code, which was granted by the AMA in 2019 for chronic wound care with diabetic foot ulcers. The codes that were granted were 0512T and the add-on code 0513T, which is specific to the dermaPACE procedure and the treatment of diabetic foot ulcers. So as discussed, the dermaPACE codes are temporary codes. The 0512T is for dermaPACE, high energy wound healing on the skin, and this includes topical applications and dressings. So 0512T is for the initial wound, and the add-on code 0513T is for the each additional wound. It's important to note that at this time that 0513T is included in the payment of the primary code. The payment rate for dermaPACE procedure codes, which CMS has assigned, is also in the same category as UltraMIST. So the APC, which is level 1 skin repair, APC 5051, is paid in the hospital outpatient setting at $179.55. That is for the facility component reimbursement. CMS has also assigned a status indicator S for these codes, which means these are not subject to multiple procedure reductions, though they can be billed with other procedures. And these codes are temporary, and per CMS, dermaPACE revenue code in the hospital outpatient setting should be 790. So as discussed, the hospital outpatient reimbursement for dermaPACE is $179.55 for the facility. And the physician fee, the physician professional fee when done in the hospital, is actually established in most MACs. Not all the Medicare areas will cover it. However, there are some we are starting to see payments on as of January 1st. The same goes for the private office physician facility fee. That rate varies based on the Medicare MAC locality. So currently there are no national reimbursement rates for the for the physician fee schedule. However, most of the MACs have their own rates. And what we found is First Coast, Novitas, NGS, and WPS have established rates ranging anywhere from $330 up to almost $410. Again, just to note that these are national average payments. In the hospital setting, the 179.55 will be adjusted based on the hospital wage index. It could be up or down, and as well as the same goes for the physician fee, where the payment is adjusted by the provider geography. Sanuwave has an excellent reimbursement support line for both providers and patients. The reimbursement support line assists with verifying patient benefits on behalf of the provider. They check for coverage for the products with the insurance plan, as well as reporting back any out-of-pocket costs that the patient may incur with these treatments. The reimbursement line also facilitates prior authorizations with the payer. They assist with denials and appeals as necessary, or if needed to facilitate any peer-to-peer reviews as well. The reimbursement line provides ongoing communication and follow-up until a final decision is reached with the payer regarding coverage or appeal. The reimbursement support line can be used as a resource for supporting materials such as reimbursement guide, letter of medical necessity, or any clinical articles required for reimbursement purposes. The line is also available for coding, billing, and reimbursement consults. And the reimbursement support line, of course, is HIPAA compliant, and they take patients' privacy very seriously. This is an example of a prior auth form that would need to be filled out to send to the reimbursement hotline. So the patient intake form is faxed to the reimbursement support team with all the pertinent patient data, and then it is processed in-house, where the turnaround time for an average approval for benefit coverage is anywhere from 24 to 48 hours. And of course, the hotline is available for any reimbursement and coding questions or basic questions regarding status of a case. This is the information for the reimbursement support line for Sanuwave. There's a toll-free number, 877-908-2448. This line can be used at any time for questions. They are available 8 a.m. Eastern till 8 a.m. Pacific. Again, the toll-free number, 877-908-2351, is to their secure HIPAA-compliant fax, and that's where you send patient information and patient intake forms. And there is a dedicated email available for questions as well.